Hey guys, Dr. Chris Strandburg here. Today I wanted to talk to you about a crown. What is a crown? Why do you need a crown? And how do we make a crown? Let's look at a patient case. In the past, this tooth had a large filling placed in it, but the patient got a new cavity underneath that filling. And now there's so little of the tooth left, it's about to break and possibly need a root canal or to be extracted. Now this is the X-ray of the tooth right here. You can see this part is the old filling, and underneath there's a darkening on the X-ray, which shows to us that there's a new cavity that's forming underneath. A top view of the tooth here, you can see part of the filling is broken out. So we're gonna have to remove that tooth decay in order to get the tooth back to health. The first step to get this tooth fixed back up is to take out the old filling and see what's underneath. Here you can see that there's a large amount of cavity, and this is all that's left of that tooth. So the first step is to take out the decay, and then we have to reinforce the tooth. So we're gonna put a filling material to make the inside of the tooth strong before we can do the crown. This is the tooth after I've taken out the cavity. We take this band, and that helps us to fill up the inside of the tooth and recreate some shape. This is after I've filled up the tooth. Now you can see it's not the prettiest thing, but that doesn't matter because it's gonna go underneath the crown. Now you can think of a crown kind of like a helmet, because we take what's left of the tooth and we protect it with what looks like a tooth but is actually a strong structure for chewing. Now the good thing is it's going to look exactly like the tooth it did when it grew in, so the patient won't be able to tell. For us to be able to slip the crown over the tooth, we have to shape the tooth into a cylinder shape. You can see that's what it looks like there. From this angle, it does not look like there's a whole lot of that tooth left. But remember, most of it was already destroyed. So this little peg of tooth is actually what's going to hold the crown in place. With the help of a laboratory, we're going to make this crown. So the first step is to get an impression of this tooth. We use this rubber material that gets us the shape, which can then be poured up into stone. Now this is a copy of what we were looking at, and there's the tooth, right there. The lab is going to use this to make the new porcelain crown. This is what the porcelain crown looks like, placed on the model. We're going to actually slip this off and put it over the patient's tooth, and it's going to stay in place with a strong adhesive cement. So this is the after. We have the crown in place here. You can see it nicely matches the surrounding teeth, and most importantly, it's going to allow the patient to chew on this for years to come. Another look with the patient's smile. This is the tooth, and here's the zoomed in portion. You can see how well it matches the shape of the other teeth. On the final X-ray, you can see the crown right here. It has a nice shape to it, and it blends in smoothly with the existing tooth. That's what we want because it'll allow the patient to keep it clean, and this should last for a long, long time. So if you have any more questions, you can send me a DM. I hope this helped a little bit.